All right, everyone, Happy New Year. So I'm here to introduce the new Canaan Director of Health. She is one of our own, Connecticut born and raised, completing her medical degree from Albany Medical College. She graduated top of her class and Alpha Omega prestigious honor medical society. She always knew she wanted to be a primary care physician and went on to graduate from Yale Primary Internal Medicine Residency Program. She's here in town to help us all and is going to talk to us today about the current state of polio. Give a warm, resounding welcome to Dr. Jaime Ruszkowski.
Thank you all so much for having me, and hopefully this will work without any glitches. So I was very excited to be asked to do this talk, and I learned a lot about the Rotary Club and their mission, which is just outstanding. So I'm going to try to go through in the less than the 30 minutes, but feel free to ask me any questions. So I'm opening with this quote, which is from Seth Berkley of Gavi, the Vaccine Alliance, which is one of the Rotary Club's partners for the global eradication mission. In the 1960s, the only thing that Americans feared more than nuclear annihilation was polio. Today, polio is on the cusp of becoming only the second human infectious disease ever to be eradicated. Problem is, we've been on that cusp for the better part of a decade. And I feel like that really sets the stage for what we're going to talk about. And I imagine you know the only disease to be eradicated in the U.S. is smallpox, which was eradicated just about 1979, before all this started with polio. So we are going to go through the polio epidemic, the Rotary Club's initiative with polio. What exactly is polio? A little blurb I have from one patient that I've had the experience of caring for, the evolution of the treatments, as well as the success of the vaccine, and the unfortunate resurgence of the virus. So, polio epidemic. So back to prehistoric times, there are drawings of people that look like they had polio. This really came up more in the late 19th and early 20th centuries. There was an epidemic in New York City in 1918 that killed over 2,000 people. But the crux of what we're talking about here happened in the 40s and 50s. So there were multiple severe epidemics, the worst of which was in 1952 with over 3,000 Americans killed. So prior to the vaccination, there were about 16,000 US deaths a year from polio. By the mid-20th century, it was worldwide. There were over 500,000 people affected by the polio virus, either by death or paralyzed. 1988, 350,000 cases of wild polio across 125 countries, with an estimation of 1,000 children becoming paralyzed. So these were huge numbers. Consequences of polio, quite scary: death, muscle weakness or paralysis, and just a lot of disability. So patients that had to use canes, wheelchairs, crutches for the duration of their life. And most notably, I'm sure many know about the iron lung and the need for respiratory support. And there are people that have lived as long as 70 years in an iron lung. We'll talk about that a little bit later, which is really mind-blowing. So Rotary was the actual first organization to envision a polio-free world. In 1979, Rotary International started a multi-year initiative to immunize over 6 million children in the Philippines. So they've been responsible for fundraising, advocacy, volunteer recruitment, field support, and really mobilizing communities to vaccinate, particularly children who had not prior been vaccinated. So still, Rotary is the main private sector donor to polio eradication, which is really quite commendable. Members have contributed over $2.7 billion to eradicating polio. And in 2007, they actually joined the Bill and Melinda Gates Foundation on this initiative as well. So well done to Rotary. over 1 million Rotary Club members volunteering their own time and resources to fight polio, so thank you. So the Rotary first started their initiative, and then that built into a bigger one called the Global Polio Eradication Initiative. And this was in 1988 and has many big partners, the CDC, the WHO, the Gavi Vaccine Alliance, UNICEF, and the Gates Foundation. And their primary goal is a precision approach to focus efforts and resources to find the zero-dose children, bring them into the health system, and that's ultimately what we believe is going to take to eradicate the polio virus. So the results of the successful the mass vaccination program is really 99% reduction in polio viruses since 1988. They estimate over 20 million cases of paralysis in children have now been prevented by this vaccine effort. And the annual number of wild polio virus circulating now is in the double digits. The last number I could find from 2023 was 13. There are only 2 remaining endemic countries in this world, Afghanistan and Pakistan. So that means there are only 2 that nationally contain the polio virus, and you can get it at high enough rates in the community circulating. And World Polio Day is October 24th, with the main effort towards vaccination on that day. And that was actually when we planned to have this talk, maybe next year, in October, if you want me back. So a little quick timeline just highlighting polio. So again, since the 1950s, the take-home point is over 99% reduction in paralytic polio throughout the world. There are 3 types of polio, which we're going to talk about in the wild, and only 1 type of those, type 1, is currently in circulation. And in 2022, wild polio cases were at about 30, and that was Afghanistan, Pakistan, and Mozambique. So bottom line, eradication still very possible. So I was born in 1981 in Connecticut. I did my training in 2008, and this is my only polio patient I've ever taken care of, which I just have her as a new patient last year. So it really is quite remarkable where we come from, especially me being born in the 80s, to not even know people in the United States. So this is how much the landscape has changed. So my patient was born in 1931. She was 17, woke up one day with a cold, and then her right leg was paralyzed. She went on, though, to get married, have 4 children, walk with a cane, and she tells me that polio does not define her, which is really remarkable. And she is now 93, still in a wheelchair with a completely paralyzed right leg and able to move about her house and lives independently, which is really quite amazing. So polio, so what is it? It's a virus. They are enteroviruses, which means that they belong in your gut, in the enteric system. They target motor neurons in your central and peripheral nervous system. So there are 2 different scenarios. There's polio, which everyone knows the active disease, but unfortunately there's also this post-polio syndrome. And that means that at any point, decades later, you can develop symptoms that are related to the polio virus that you had. So wild polio, the regular polio that's out there before the vaccine. The first polio virus was successfully cultivated in human tissue in 1949. So that led to a Nobel Prize, I believe, in the 50s. They found the 3 wild types. Type 2 was eradicated in 2015. Type 3 eradicated in 2019. And currently efforts are focused on the type 1. So you may be wondering what wild means, but now you know that there is a vaccine-derived polio virus, which is a consequence of the 2 different types of vaccines, and we're going to get into that. So this is actually one of the biggest threats right now, and it's derived, they're when they came up with the oral vaccine, these are live attenuated vaccines. So these are vaccines that have a very weakened strain of the virus. And unfortunately, it was found years later that that weakened strain could mutate back to a virulent strain capable of causing the disease and paralysis. So in 2023, there were 500 of these vaccine-derived cases across 20 countries, which is higher than the 30 of the wild type. And because these are enteric viruses, and we're going to talk about how they're spread through the fecal-oral route, just like the common GI bugs you pick up, you can detect them in sewage. And that's how they actually are able to calculate if there's polio virus still circulating. So type 2 vaccine-derived polio virus has most recently been found in London and New York. They've also, Israel has been another hot spot. So the bottom line for this is that yes, we're talking about developing countries for wild type polio, but when we're talking about people that are at risk, it's people also in higher income settings, resource rich, such as the United States. So how does the virus transmit? Just like your normal stomach bug, you're not so great at washing your hands maybe, there's a little bit left over, someone gets it on their hands, in their mouth, the virus lives, goes through your gut, into the oropharynx, into your mouth, into the GI system, and the problem is that it's able to stay there and still be infected and shed for weeks. And this is also true of the norovirus and other viruses that are out there. There's a current norovirus outbreak right now. This is the problem. So in your stool for weeks, particularly in children and infants where you're doing diaper changes, can still transmit the polio. And they're also present in nasopharyngeal secretions, which is basically, if you blow your nose as well. So there's two different ways it can be transmitted. Replication of the virus. So the mechanism of how the virus enters your central nervous system is really not well understood to this day. But what we do know is that the virus replicates in those neurons, resulting in complete death and paralysis of the muscle fibers that those neurons supply. And it can also involve, so the neurons, when we're talking about motor nerves in your spinal cord that supply your muscles, that's one area, but there also are cranial nerves in your brain that can be impacted. Those are responsible for movements of your facial muscles, for tracking your vision, for swallowing, for talking, and this is really also where we get the brainstem involvement where you're unable to breathe and use your muscles of breathing. So clinical manifestations, so there are certainly many people that can have a mild illness, just fever, headache, sore throat, not detectable from any other virus. That can even resolve within 2 days. The severe illness is what we focus on, obviously. There's two different variants. If you're lucky, you get the non-paralytic form, which largely involves the meninges, which is the covering of the spine. And if that fluid gets infected and you get a meningitis, you can have a very severe outcome. And also the paralyzed form, which involves an acute flaccid weakness, which is basically no tone. So flaccid means there's no tone in your muscles, so dead weight in your muscles, completely useless muscles, or group of muscles. So you can even be quadriplegic with this virus. And again, it can affect your respiratory muscles and ability to breathe. It's pretty symmetric, means it involves both sides, typically not just one side. So it's atypical that my woman has one leg affected, apparently. More common to have proximal, closer muscles affected than ones that are farther. So farther muscles would be ones in your hand versus proximally your forearm. Legs, though, are more common than arms. And the difficulty swallowing, talking, hand-wave secretions, that's all involved in the cranial nerves. And the respiratory failure, which I think I've highlighted. So this, I think, is really amazing. So pre-vaccine management, the iron lung. So, it wasn't until the 1980s that the current ventilator machines that we all know now, which I completely take for granted. I've only had my training in times where we had very sophisticated respiratory machines, all came initially from the polio virus. So this is how it all started, where they needed to have a device to breathe for the person. And they used pressure outside the body, and now obviously we're able to get that pressure inside the lungs. So this is the iron lung, and this is the last known polio survivor, Paul Alexander, who just passed away last year. So there's actually a great documentary I've not yet watched on him. He lived inside this iron lung from 1952 until 2024. Wrote with his tongue, with a pencil, and became a lawyer. Fascinating. So hopefully this is gonna work. I think there's a little ad, but oh gosh, I think I can do it. No, it's not looking good. Hold on.
A doctor, I understand.
Okay, back to this way. You're gonna have to watch a little, there's a little like 30-second ad. I would not be very good at technology. Hold on. What is that? Okay. Let's see. Okay, so this is from the, it's not really transmitting. Okay. I can't get it to work. It's on my computer, but it's not connecting anymore, so I don't know.
You have to select that window. I don't know.
Let me try. I feel like this is something I should be capable of. Okay.
Is that a Mac or a PC?
No, is it Mac?
Is that a Mac or a PC?
Probably that
He
machine.
said something about hitting this button, but. Well, happy to send the slides if anyone wants them, with the video from the BBC, which is very cool. It's like a 2-minute summary of the iron lung, how people live with them. Oh, thank you. Are we okay on time?
I have a question.
This is a PC. Does anybody else use a PC every day? I use a Mac.
Is the vaccine-derived virus just as dangerous as the wild virus?
Yes.
Yeah.
Yeah.
Same thing, basically.
It's the same exact thing.
Okay.
So viruses these days, the only ones that are inactive, well actually the majority are inactive killed vaccines, except for measles, mumps, rubella, which is a live virus. The old chickenpox vaccine, now I forget the name of it, now we have Shingrix, Verivax I believe, is also, Zostavax was alive attenuated.
Which one of these? Whatever you have here is there.
Okay.
Which carrot? There.
Okay, I have to go there.
You got it.
I'm so close, I feel it. Oh, I don't know why I keep saying that.
It's gonna be a different file. So you gotta go back to it.
I don't know why it's doing this thing.
Just do a PowerPoint presentation. This is the PowerPoint presentation.
Yeah, I should try that.
That's up.
Oh, yay! That was easy. It's just a little 30 seconds of an advertisement if anyone has any questions. I don't think you can skip it, but.
First, I wanted to be a jockey. First, directing all the ones that we realize I'm coming into the stores like I really don't understand the question right now. I've always known that I wanted to be a nurse.
Middle
If
split.
you guys want to guess where a million is on this board, if you want to do it, 1,000, billion, where is a million? It'll be fun.
Thank you
Ooh,
so much.
it's a lady scale, yeah.
What's that?
press period. But why was it invented?
What is that audio? Okay, that's weird.
Polio was ravaging Europe and North America.
Okay.
The worst cases involved muscle paralysis, a symptom that when affecting the spinal cord meant the patients couldn't breathe, a condition that almost certainly sealed their fate.
Okay, alright, I'm gonna try to go back, but
A massive airtight metal box.
this is totally gonna be worth it. I know, you're all wondering. It's gonna be worth it. Spiraling. I thought it was cool. But you know, I didn't experience any of this, so really, for me, it's really amazing.
But thank you for taking the time to find it.
Yeah,
March it down.
I feel like it's gonna work.
Telephone,
Any other questions?
Jerry's kids.
I just have sorry, just a
Sure.
quick comment. So in 1952, when my husband was 5, he contracted polio.
Oh, wow.
And his first cousin did as well. His first cousin ended up with a lung, not an iron lung like that.
Wow.
But, and Randy was in the hospital for, I think, about 3 months, and when he was 5, and then has never really shown any symptoms or aftermath of that. But are you see? Question is, do you see? I know you don't see a lot of people who actually have it, but
Yes.
how about those who did have it? And sort of, is there a sort of percentage of the?
Yes, and actually I don't have that in here, but there is a large percentage of patients who have very minimal disease, and that's similar to all viruses, right? COVID, and that's how it spreads, because it can't be severe in everyone. It can't kill everyone, or the virus wouldn't be able to survive. So that's a very good question. I can get you that later. I did come across that in my reading, but I didn't put it in. And also what's fascinating is, so I thought, you know, this patient, like how, okay, you got it, how many of your siblings, how many, none. Did your parents have it?
Respiratory care. But metal box, invented by scientists in 1927,
Okay.
revolutionized respiratory care. But why was it invented? In the early 20th century, polio was ravaging Europe and North America. The worst cases involved muscle paralysis, a symptom that when affecting the spinal cord meant the patients couldn't breathe, a condition that almost certainly sealed their fate. Enter the iron lung, a massive airtight metal box wrapped around the body of the patient to make sure their lungs kept doing their job even when their muscles couldn't. So, how did it work? Patients would lie in a cylindrical chamber with only their head exposed, while the machine rhythmically changed the air pressure inside the chamber. As the pressure decreased and increased, the patient's chest would rise and fall, just like the natural process of breathing. An 8-year-old girl was the first to receive the treatment. She went from near death to breathing normally within seconds of being put into the box. Despite being a life-saving device, the iron lung wasn't without limitations. Patients needed round-the-clock care and were confined to the machine, often for weeks or months at a time, which limited their mobility and quality of life. But the iron lung fell out of use with the arrival of the first injectable polio vaccine designated safe to use in the US in 1955. Today, 92.5% of children in the US receive the polio vaccine by age 2. But the iron lung was a real hero in its time, keeping people alive when they needed it the most.
So, as a physician, that gives me chills, because when you live through these times as a physician, I can still picture, you know, I took care of COVID patients in the hospital, and I can still picture what that looked like in my mind. And so I felt like that was very impactful to show how people felt at the time, and I think that's what a lot of people lose as they start making those decisions to not vaccinate, unfortunately. Okay, good. So finally, the vaccines. Oh, sure, go ahead.
So if someone gets vaccinated, then it can undo the effects of the polio?
No, I'm gonna explain that right now.
Okay.
Yeah, and you had a question too.
So you hear on the news, and what to believe on the news sometimes, but that some people are not in favor of the polio. And can you speak to that, or is that true?
I can only say that as a Yale-trained physician, vaccines are the biggest success in science. That's all I can say.
Yeah.
They're very controversial now, but I will tell you that we are in a very lucky place. We don't know what a lot of these diseases are. So, you know, we know what COVID is, but we have to really, I think, just focus on science, and that is my belief.
But is the government or the group trying to get rid of the polio vaccine?
Not to my knowledge. No. Definitely not to my knowledge. I'm gonna talk about that too. Yep. So, first vaccine ever, amazing. Dr. Salk gave it to all his family and friends, inactivated, killed virus, and it was injectable, 1955. So the IPV is what we call that. So it protects against all three subtypes of the wild polio virus. So there's nothing live, it cannot cause disease. Killed vaccines cannot ever cause disease. So it protects people from polio, but it can't stop an active outbreak or transmission of the virus. The only polio vaccine that has been given in the US since 2000. So this is the current polio vaccine in the United States. Polio vaccination has been part of our routine childhood vaccine schedules for decades here, and I'm gonna go more into that too. This is the other vaccine, and this is unfortunately the vaccine that positive is 99% reduction in polio, and it got us out of the epidemic. But the negative is it did create those vaccine-derived viruses. So this is the Sabin vaccine. It is an oral polio virus. Most oral vaccines are live. So this is attenuated, which is a word that we use to say weakened. It's missing certain parts of the vaccine that would allow it to be virulent and cause disease. So this was a big hit when it came out. It was much easier to go around and give people little tiny drops of the vaccine than it was to get people to be injected. It does contain all three different subtypes. Now, the amazing thing about this is because it's through your gut and you're taking it orally, that's where the polio virus is transmitted. It is also able to stop outbreaks. So it is acting how polio is spread in the same manner as opposed intramuscularly to a inactivated vaccine. So this really was able to contain outbreaks, but unfortunately the more you give of this, the more vaccine-derived polio is going to be able to be circulating. Anyone that has the oral is not at risk for getting polio. You are protected. But if someone did not get the polio vaccine at all, they can get sick from these derivatives. Does that make sense? Okay. So it can contain an outbreak, and the goal is you would stop using this so these wouldn't be in circulation anymore once polio is eradicated. But it's never going to be able to happen if we still use this, which is why the US reverted to the inactivated vaccine, because we are not a country that has high circulating polio.
So
Yes?
if you had 100% vaccination with the oral,
Yeah.
it couldn't transmit.
Correct.
Or somebody, because you can't get it from the oral, but you can give it to somebody.
Okay, let me rephrase that.
Well, I think my question too on that is it because the virus is weakened and not dead that it can spread, and in the weakened form can cause, no?
Nope. So how it works is when you have a live attenuated vaccine, they maybe took out one protein that allows it to actually get inside a cell, right? So the scientists configured it so they took out the way that the virus spreads. But when it goes into your own body, your immune system is able to recognize it, fight it off, and it's so great at that because it is the virus. It's almost the entire virus. So you're getting really great immunity. So once you are vaccinated, you are not going to be able to get polio. Your body is going to fight that. But if my friend Ted over here never got a vaccine, and I was somehow if I was somehow able earlier to spread in my stool some of that oral polio that I was vaccinated against, over decades, that polio that was harmless can mutate and find its way back to getting into someone's cells. That's what they didn't anticipate when they did this. Who would anticipate that the virus would be able to mutate back, find that protein that didn't allow it to get into a cell? But that's what it did. And they didn't find out that for decades later. But the problem is, they still had to use it because it had the most active immunity, had the most ability to contain when we're talking millions of people that have it. So it's a double-edged sword. Does that make more sense?
But the question is, if it's 100% vaccination, then
Oh.
theoretically,
100% vaccination means, so if you're vaccinated, you're safe. The polio vaccine is fantastic. It's not like the flu shot, which is like 60+% effective, or the Shingrix shot, which is 95% effective. Polio is very effective. So you're not gonna get polio if you are exposed to one of those vaccine-derived viruses.
Right.
But it's someone else that is not vaccinated. So if we eliminate all the people that are not vaccinated, it cannot spread even if it is around. That's the goal, is to get every single person vaccinated, because if every person is vaccinated, it cannot continue to replicate and spread in people's stools
We gotta let her
without
finish.
symptoms, etc.
But then, didn't you say the Salk vaccine is
Yes.
now, has been used
In the
exclusively
US,
since
yes.
2000?
In the
Okay.
US
Only
it
in the
is.
US?
I can't speak to all the other, I mean, a lot of it, obviously, I'm an internist, so I do a lot of this, but I am by no means, I hope I'm not presenting as some polio expert. I do the best I can, but with my basic knowledge. But there's a lot of intricacy involved here, and it was really unexpected that vaccine was going to revert to a virulent form.
So the Salk, is that an injection?
Salk is injection, inactivated, so IPV. And you will see if you look at vaccine cards, as I do all the time, some people need us have OPV, some have IPV, because they've switched in between.
Or both.
But yes, you can actually.
And I remember the shots, and
Yeah.
then we had to, after they put me through the shots.
that's the
then
mark
they
on my
made-
arm.
Yeah.
Well, the mark on your arm is smallpox.
That's
Oh, I know
smallpox.
that.
So, yeah, sorry, someone else said
But
that.
they were big shots.
Right, and so, and
I was
also,
little,
it's
but-
it's pricier too, even though they said it was like 10 cents a shot, but,
We used to give, if you were a kid in the 50s in elementary school, you put dimes in the marching
Yeah,
band.
remember?
Right, yeah.
And
You
all the-
collect-
Those
and
little-
you collected money,
Yeah.
and then Jerry Lewis had a telethon
Yes.
with Jerry's
Muscular
kids.
That's muscular
It was the most
dystrophy.
scary thing anybody, and when they finally came up with the saw.
I know, this makes a good
then
story.
Everybody breathed a
Saving
sigh of relief, but the very idea that people would say, stop vaccinating people, even if a few of them go to vaccine-derived, cost-benefit, 99% of the people saved, 1% still have a problem. That's a reason to do it, if nothing else. And the very idea that people might stop it and we're gonna see polio again in this country, in this century,
Yeah.
is just insane. It's just insane.
Yeah.
agreed.
So is it safe and
Well, that's
easier
what
to administer though?
Yes, and I believe you told me you had it as a child on a drop, on a sugar cube.
Yeah, you were lined up.
I still have more time, but I don't know who has to leave. I have a couple slides left, so you tell me.
Yeah, we should let her finish.
Let's finish.
I think we should too. Thanks.
Okay, wonderful. All right, so that's the oral attenuated. We talked about that. So current management. So to this day, there's no approved treatment. It's only vaccination, which is again why we're harping on getting the children that are not vaccinated their first dose. So there's really just supportive care, pain management. A lot of those deformed limbs are very painful, as you can expect, especially over time. Physical therapy and the respiratory failure, which we talked about. So how does polio still spread today in 2025? So I think we talked about that. It's through the unvaccinated people and the fact that many people were vaccinated with the oral virus. So those circulating vaccine-derived polio viruses can actually cause disease in the non-vaccinated, under-immunized populations. And I thought I had a slide on it, and maybe we'll get to it, but the last case of polio in this country was in 2022 in New York City. I know I have a slide on it, but, oh, here it is. June 2022, an unvaccinated, completely healthy, completely immunocompetent, meaning no problems, got polio, paralyzed. And what they found, because the CDC is able to examine the sewage, is that there was type 2 vaccine-derived polio virus circulating in New York City, in multiple neighboring counties. And so I'm just gonna go back here. So there is very limited areas of wild type virus, which is the virus that is naturally circulating. And there's rare cases still of the vaccine derived. But this is how it's able to keep spreading. And these are the only current endemic countries, Afghanistan and Pakistan. So back to this slide in the United States. So the last US case of polio by the wild polio virus was 1979. The World Health Organization declared us polio-free in 1994. In 2005 is when there was one case of the type 1 vaccine derived. In 2002 was this poor individual with the type 2. So it's the unvaccinated people in the US remaining at risk for paralytic polio. So I don't want anyone to walk out of here thinking you're at risk for polio. You are not if you are vaccinated. But it has led to some questions about boosters. So we're going to talk about that too. So polio vaccine in the US. So again, 99% reduction in wild polio. In the 1960s, they still were using the oral polio virus, trivalent, which means 3 different types of polio, all the polio. And that eliminated largely the wild polio virus and transmission in 1979, same time as elimination of smallpox. 1996, we started using the current enhanced, there's a form that's more potent of the inactivated. So we switched back to that completely in 2000. 1999, 2000, we switched back to the IPV, which is the inactivated schedule. So current children in the United States are going to be receiving that on this schedule. 2 months, 4 months, 6 through 18 months, and again, 4 through 6 years. So this is about 93% coverage, which really isn't that great when you think about it. But that's where we are in the United States with the inactivated virus. So this is the Advisory Committee on Immunization Practice. This is what we follow as physicians through the American College of Physicians. So they did update their guidelines in 2023 after that poor New York lad got a vaccine-derived polio virus. So they re-examined, and the cost benefit is that people that are at high risk, even if you have been vaccinated, why not get a booster? And they say it's okay to get either oral or inactivated at that point. So now I do ask patients, if you're traveling somewhere, so specifically Pakistan or Afghanistan, you may want to consider it. So any international travelers can be in contact with someone who's traveling there, of course. So any international travel, laboratory workers, and that's also a problem. We're still using these, we're still studying them in the lab, so they're at risk. Healthcare workers, but largely they are now recommending that we give a booster for people who are at risk. Goal, still eradication, should not have to vaccinate at all. That's the goal, like smallpox. So there are some novel vaccines that they have developed, and they're using them under emergency authorization, which I'm sure we're all familiar with now. And many people are getting those across the world. I'm going to go through these in the interest of time. There is research out there, obviously, for treatments about, actual drugs that are antiviral drugs, such as Tamiflu for flu, Paxlovid for COVID, right? But we don't have that yet. Producing vaccines from non-infectious sources so that we don't end up with active viruses from people who are vaccinated. And also the people that do have immunodeficiencies that aren't able to be protected. There's ways that they're looking about that as well.